Chapter 9, Therapeutic Communication. So communication is foundational to all human relationships, and we cannot not communicate. Even our silence speaks volumes. Professional therapeutic communication is patient-centered, goal-directed, and scientifically based. Good communication is beneficial to patients in that it helps them feel safe and protected, more satisfied with their care, increases recovery rates, and improves their adherence to treatment. So the transactional model of communication. This model is useful for psychiatric mental health nurses. We communicate to create and build relationships rather than just a means to share information. So the communicator. The roles of both the sender and receiver are fluid because they are both communicators. They are also interdependent because communication cannot occur if the other person is not listening. Message. The ideas that are being exchanged, as well as nonverbal communication. Channels are how the communication occurs. Feedback. Constant feedback is given by both parties, the nurse and the patient. Encoding, decoding. One individual develops the message and the other determines the meaning of the message. Context. Influences the interactions and can include social, relational, or cultural context. Environmental noise. This is a barrier to interaction. It can be physical, it can be physiological because of like illness or fatigue, or psychological, like your mind is wandering or you're preoccupied. On page 138, figure 9.1 is also another version of this. So we're back to Peplau. So Hildegard Pepplau's interpersonal theory focused on clarity and continuity as the guiding principles of communication. Clarity ensures that the meaning of the message is accurately understood by both parties. Continuity promotes connections among ideas, feelings, events, as well as themes. Peplau also suggested using non-directive listening, which would allow the nurse to help the patient process their feelings without judgment. So you are a new nurse in a psychiatric ward for adolescents. Noah is your first patient. He is depressed and has fresh cuts on his wrist, which is why his mother has had him admitted. While taking his pulse, you see that Noah also has a number of older scars on his arm. When he sees you looking at them, he shakes his head and whispers, "Yeah, well, it's just going to keep happening." Noah's whisper statement of, "Yeah, well, it's just going to keep on happening," does not involve which of the following. D. Feedback. Feedback is provided by the person receiving Noah's message after interpreting and responding. What is an appropriate response to Noah's whisper statement of, "Yeah, well, it's just going to keep happening"? C. Tell Noah you are willing to listen if he wants to talk about this. Noah's statement implies a desire to be understood and perhaps helped. He sends his message through a whispered statement meant only for the nurse to hear, so a response is needed. That way he knows he is in a safe place and can express his needs and his feelings. Factors that affect communication. Think about a conversation you have had recently that did not go as you had planned. What factors were present that affected the communication? So personal factors, these can be things like depression, cognition, but also language and cultural barriers. Environmental factors can include things like background noise, lack of privacy, or an uncomfortable condition. And then relationship factors. This is the level of equality within the relationship. Inequality results when one person has authority over another, such as in the nurse-patient or teacher-student relationship. This is known as a complementary relationship. This can also be evident in social status, gender, or even educational differences. So, verbal communication. These are all words a person speaks. We communicate our beliefs and values. We also communicate perceptions and meanings. Verbal communication can convey interest and understanding, but also insult and judgment. We can give clear or even conflicting messages and honest or even distorted feelings. But nonverbal. Nonverbal cues are a better predictor of attitudes and feelings than words. Nonverbal communication includes your tone of voice, emphasis on certain words, physical appearance, facial expressions, body posture, amount of eye contact, and hand gestures. This table on page 139, 9.1, gives you several examples of nonverbal behaviors. So, interaction of verbal and nonverbal communication. Number one, messages can appear to be one thing when in fact they are actually another. Number two, people are often less aware of their nonverbal messages and behavior. And number three, verbal message can be called the content, while the nonverbal behavior is the process. And then there's something called a double bind message. And this is a mutually contradictory message. It's usually given by a person in power to exert control. For example, a mother saying that she loves her child, but then she turns away from them in disgust. So as you prepare for the initial interview with 15-year-old Noah, you learn that he has a history of cutting himself. His parents have separated and are getting a divorce. His father has left, and Noah is living with his mother. Noah has been smoking for about 1.5 years, and his mother suspects that he has come home smelling of marijuana twice now. All three behaviors were ongoing before the father left. Which behavior from Noah would you consider a double bind message? C. He sneers at you and almost purrs as he says, "Oh yes, I will tell you anything you want to know. Of course I will." Noah is in an uncomfortable situation and is attempting to gain control or power. He knows you want information and his cooperation, but he does not want to give it, so his nonverbal message contradicts his verbal message. So, therapeutic communication techniques. These techniques are going to help achieve patient goals. The first is silence. Silence is not just the absence of communication, but it allows the patient to have time to think and reflect. Silence can make some people uncomfortable, so do not try to fill the gaps with questions or chatter. However, silence should be used very rarely in young people and adolescents because it truly does make them uncomfortable and has the opposite effect. Active listening involves listening to understand and not just listening to respond. The focus is on the patient and the nurse observing nonverbal communication, reflecting on what the patient said, and then providing feedback. Active listening helps strengthen the patient's ability to solve problems and build their self-esteem. Clarifying techniques should be performed to avoid misunderstanding or misperception. This includes paraphrasing, restating, reflecting, and exploring. I would look up and be familiar with the definitions of each of those. And then questions. We want to ask open-ended questions when possible because this helps establish rapport and encourages the patient to share with you. Closed-ended questions usually require specific information and are used in the initial interview and assessment. Projective questions start with "what if," and they help explore feelings. And then there's the miracle question. That involves the patient reflecting on what their future would look like if their problem did not exist. Table 9.2 is an important table on page 142 and 143 of your book. So non-therapeutic communication techniques. Non-therapeutic communication can hinder the nurse-patient relationship. You can do this through excessive questioning, giving approval or disapproval, giving advice, but also by asking why questions. Table 9.3 on page 144 gives you several examples. So Noah has made it clear he does not want to talk about his dad. But the truth is, as the interview proceeds, he becomes anxious and tries to evade all questions about why he is here. Which type of communication might be most appropriate right now? D. Ask a miracle question. While he is anxious about saying anything specific, he may be able to talk about what he wishes for and can get to the source of the most important issues in his thinking. The other three examples are non-therapeutic communication techniques. Cultural considerations. Different cultural components can make it difficult for effective communication. So communication style. How does the culture express body language? Is it private or open? Are they quiet or loud? Use of eye contact. Is eye contact a sign of respect or is it a sign of disrespect? Perception of touch. Usually touch is perceived as a comfort in times of distress, but touch can be viewed in some cultures as an invasion of privacy. So be very careful with children and adolescents who have been abused or touched inappropriately. And then cultural filters. Bias or prejudice forms what we focus on and what we ignore in the world around us. Information communication technology is the use of electronic information and telecommunication technology to support long-distance clinical health care. It's used to track data and also provide access to people who otherwise do not have access to medical care. Telehealth technologies can include things like video conferencing, internet, phone consultations, phone counseling, image transmission, and interactive video sessions. Telehealth technology is helpful for those living in those remote areas without adequate access to care or those that are homebound. And then, since most Americans now have smartphones, these mobile applications, these apps have become increasingly popular to monitor, diagnose, treat, and communicate patients. SAMHSA, the Substance Abuse and Mental Health Services Administration, offers free apps for suicide prevention, bullying prevention, and underage drinking prevention. Now, there are concerns. Privacy and confidentiality can be an issue, as well as lack of data for efficacy and safety. There can be liability issues, and there's research that's needed to be done to evaluate risk and benefits. But we also need to make sure we're maintaining professional and ethical guidelines. So preparing for the clinical patient interview. When we do the pace, allow the patient to determine the pace of the interview, whether it's slow due to depression or whether it's fast due to mania. The setting, the area should be private and help the patient feel secure, but should be within view of others. Seating. Usually patients and nurses are sitting, but some patients may choose to stand or to pace. The nurse should be able to exit quickly, so the patient should not be between the nurse and the door. Introductions occur during that orientation phase we've already spoke about. In initiating the interview, so when you initiate your interview, begin by asking open-ended questions. There are tactics to avoid. Do not argue, minimize, or challenge your patient. Do not give false reassurance. Avoid interpreting or speculating. Avoid probing into sensitive area the patient does not want to discuss. Avoid trying to sell the patient on accepting treatment. Avoid joining in attacks the patient launches on others, and avoid participating in criticizing other staff members. On page 148, you can look at the box here for examples of tactics to avoid and what you can do in their place. So these are all attending behaviors, and attending behaviors support counseling. Kinesic communication, these are types of nonverbal communication that we've already talked about. Your vocal quality is called paralanguage. This is your volume, your pitch, your rate, and your fluency all influence how you're vocalizing and speaking with your patient. Proxemics is the study of personal space. So think of this as being a person's comfort zone surrounding themselves. And there are several points here that you can read about that are related to Western culture. And then process recordings. A process recording is a written document that is closely verbatim to an interaction between the nurse and patient. This includes both verbal and nonverbal communication. If you ever use this process recording, you need to use quotes and you need to, or quotation marks, and you need to make sure that you say verbatim what the patient says. Table 9.4 on page 150 gives several examples of process recordings.